Good morning, everyone. Thank you for joining the webinar and thank you for patiently waiting for the session to start. So the webinar is going to be on the benefits of group medical insurance policies. All the policies have been renewed effective 24th December 2020. There are some additional benefits included this year. The entire presentation will be for 60 minutes. Most of your question should be clarified during the presentation. However, if you have any specific question or clarification, please share it on the Q&A window and we will have them addressed in the last 30 minutes. All of you must have received the e-cards via TPA. There was an email that was received from ecard@fhpl.net. This has been sent to all the joiners up till December 20. In case you've not received one, please reach out to HR@Medgeno and we'll be happy to help. The updated policy will be uploaded on EaseWork right after this session. You can always use that as a ready reckoner on the policy details. Okay, without further ado, we'll invite Mr. Madan Mohan from WMG, our insurance partners, to take you through the coverages, inclusions, exclusions, etc. Over to you, Madan.
Thank you, Vashna, and good morning, everyone, on the session. So I'll be talking more about three policies today, three insurance policies. One would be the medical insurance, second would be the personal accident insurance, and third would be the term life insurance. So as Vashna mentioned, please raise your questions in the Q&A session chat, so that we answer all the questions together once the presentation is over. So we'll be talking about medical insurance first. So the policy has incepted, that is started on 24th December 2020, and this is valid till 23rd December 2021. So what does it cover? It covers any kind of hospitalization expenses due to any kind of illness or accident to an employee or their dependent. So when I say dependent, it will be the spouse and two dependent children who are aged up to 25 years and two parents, or it can be parent-in-laws. Differently able children are also covered under the policy who are financially dependent on the employees. So they do not have any upper age limit of 25 years here. So I repeat, here an employee is covered, their spouse is covered, there are two dependent children who are covered again under the policy, and two parents or parent-in-laws can be covered under the policy. The sum insured options are again graded. So it is 3 lakhs, 5 lakhs, and 10 lakhs. This sum insured is per family. So it's on a floater basis for the family. As in floater basis means it can be used by one person within the family up to the whole sum insured in aggregate per year, or all the family members together maximum and can use up to the sum insured. So let's suppose somebody has 5 lakhs. Either an employee or their spouse or a children or a parent or parent-in-law can use up to the whole sum insured of 5 lakhs in a year, or all of them together can use maximum up to 5 lakhs in a year. Both cashless as well as reimbursement claims are paid under this policy. Cashless as in if it is a network hospital, then the cashless triggers. And if it is a non-network hospital, then the reimbursement triggers. So we'll discuss more about the cashless and reimbursement in the next slides. As last year, the insurer remains the same as New India Assurance Company Limited. So please remember insurer name always. And the TPA is also the same, Family Health Plan Limited. So please remember Family Health Plan Limited too. Okay, and we are the intermediaries, we are the brokers here. Why do you need to remember TPA and insurer? In case if you are not carrying your health card to the hospital, you can always inform the hospital that yes, the TPA for your medical insurance is Family Health Plan Limited and the insurer is New India, and accordingly the form can be filled along with your employee ID and it gets taken forward. So as mentioned, the policy covers any kind of disease, any kind of illness, any kind of injury which can be treated medically or surgically by the way of hospitalization for more than 24 hours at any nursing home or hospital in India. Okay, the 24 hours condition is must for any kind of hospitalization, and the treatment can happen only in India. No treatment abroad is honored under this policy, and there has to be an active line of treatment. The age limit under the policy is day 1 to 100 years. So the baby born is covered immediately up to the whole sum insured under the policy, and aged people up to 100 years are covered under the policy. So any person in between this age group is also covered. Dependent children are covered up to 25 years only. In case if they are differently abled, as mentioned in our earlier slide, they are covered under the policy without any upper age limit. Ambulance charges are paid up to 2,000 rupees per event. This is while they are going to the hospital and not in the return. And if there is a shift between a hospital to the other also, it is covered up to 2,000 rupees. Please note, it is 2,000 rupees per hospitalization or per event, we call it as. Ambulance charges are not paid in the return from the hospital to home unless a life support is required. Ayurvedic treatment is covered under the policy if it is taken in a government recognized hospital or a government hospital, and there has to be an inpatient treatment here. Oral chemotherapy is covered up to 2 lakh sum insured. So this is related to cancer treatment. If there is an oral chemo being done, then it is covered up to 2 lakhs in the maximum, irrespective of the sum insured. So this is within the sum insured again, please note that too. Domiciliary treatment is covered up to the family sum insured. Domiciliary treatment as in anybody taking active line of treatment at home if he is in an immovable condition or if the hospital beds are not available. Like in the COVID scenario, many places the beds were not available and people were advised to take treatment at home. Okay. Taking treatment at home means it is not that I am taking medicines and staying at home. There has to be an active line of treatment. There has to be a regular monitoring by the doctors and the nurses. The case sheets are being made. So it's similar like the hospital setup at home. Okay. Doctor monitoring, the nurse monitoring has to be regular and the case sheets have to be there. There has to be a discharge summary. Then that treatment falls under domiciliary treatment. And that is payable under the policy up to the sum insured limit. Pre-hospitalization expenses are paid as in, suppose somebody has fever. Let's take the COVID scenario itself. Somebody has cough, fever or something. What does a person do? He probably tries to take some medicines at home. And if it still doesn't come down, he will visit a doctor. Doctor also would suggest some kind of tablets and send him back. And he would wait for another 2 more days. And if still the fever, cough, or cold doesn't come down, he is advised to take some kind of tests. So there are expenses again incurred for the tests and the medicines. And if the tests are proven to be COVID, then he is advised for admission into the hospital, right? So any expenses which are from the date of hospitalization are covered by the insurance policy. So what happens to the expenses that I have incurred prior to hospitalization, like all the consultation fee which I have given to the doctor, the medicines what I have purchased, the kind of test that what I have got it done before admission. So those expenses fall under pre-hospitalization. So you can claim these subject to there has to be a hospitalization following the pre-hospitalization expenses. Okay, if there is no hospitalization there, then these expenses fall under OPD, that is outpatient department, and are not payable under the policy. Similarly, post-hospitalization expenses. Under post-hospitalization, once the person is discharged from the hospital, and there has to be a follow-up treatment, follow-up dressing if somebody has an accident, follow-up medicines that have to be used. So then that is covered up to 60 days post-discharge. I forgot to mention about the pre-hospitalization. It is 30 days before the admission. Similar way, post-hospitalization is 60 days post-discharge from the hospital. Okay. One more example, let's suppose somebody had an accident and was there in the hospital for a week or so. And then once he is discharged, he is allowed to go home, but at the same time, he has to regularly go for dressing to the hospital or has to go for a consultation after that. Or if there is a physiotherapy after that, after getting discharged. So those fall under post-hospitalization expenses. Pre-existing ailments are covered from day one under this policy. Since it is a group policy, all the pre-existing conditions, suppose somebody is suffering from diabetics or hypertension, somebody already has cancer in the family, or is suffering from cancer, somebody who is regularly going for dialysis, or any kind of ailment that is there in his body and a treatment has to be done. Okay, so those treatments are called pre-existing treatment ailments, and all these are paid from day one under the policy. The sum insured, so we'll talk about the room rent here. For 3 lakh sum insured, the room rent for the normal room is 5,000 rupees, and for ICU it is 10,000 rupees. Okay, this is per day again. So 5,000 rupees per day for a normal room, and for ICU it is 10,000 rupees per day. And for 5 lakh sum insured, it is 7,500 for the normal room per day, and again 15,000 rupees for ICU per day. Okay. Suppose I am getting admitted into a higher room category. So instead of 5,000, if I am getting admitted into a 7,000 room, then as a claimant under the policy, I need to bear the difference of the room rent of 2,000 rupees. As well, all the other charges, let's suppose the doctor visiting the 5,000 room and the 7,000 room would be the same, but the charges what he levies are different. Similar way, the diagnostic expenses also have a variation, and all other charges also have a variation depending on the room category that we choose. So the difference in the room rent as well as all the proportionate charges will have to be paid by the claimant. So please ensure that you are getting into the room that you are eligible for and not beyond it, or you will have to pay the difference. There is no capping on any of the ailments. Normally, lifestyle ailments are capped. Okay, something like a cataract, knee joint replacement, or kidney stones and all. So those kind of ailments are capped, but under your policy, there is no ailment that is capped. Okay, except for the maternity, which will come in the next slides. So other ailments are not capped, and there is no co-payment also. Co-payment as in a minimum amount has to be paid by me from my pocket as a deductible. Okay, so that co-payment also doesn't exist. But the non-medicals which are not payable under the policy, so those things have to be borne by the claimant only. Congenital internal diseases are covered under the policy, and any external congenital is not covered unless and until it is a life-threatening situation. Congenital as in anything that is there from the birth. Okay, let's suppose somebody has a hole in the heart from the birth. Okay, so that's covered under the policy. Okay, that is internal, and something external example would be the cleft lip. Okay, which is again not covered under the policy because it is again not a life-threatening situation. Abortion will not be counted as an event under the policy. So I'll explain this more in detail once we move to maternity related coverages. For 10 lakhs sum insured, the room rent is 10,000 rupees for normal room and 20,000 rupees for an ICU. And here also the proportionate charges are applicable. Special conditions: hospitalization arising out of animal or serpent attack, animal attack or serpent bite are covered under the policy. So somebody is bitten by a snake, or there is an attack by an animal. It can be a dog, it can be a wild animal, or it can be an ox, domestic animal. Those are covered under the policy. There is no deduction in case of death during hospitalization, only for the employees again. There is a 50% copay for cyber knife treatment, gamma knife treatment, stem cell transplant. So CyberKnife again is related to cancer. If there is a stem cell transplantation, so there is a 50% copay again. Robotic surgery involves 50% copay. Femto laser treatment for the eye and cochlear implants also have a 50% copay. HIV or AIDS cover. So HIV and AIDS is covered only for the employee if there is any. Okay, only an employee is covered as an exception here. Bereavement cover, as in if there is a hospitalization and during the hospitalization if there is a death. So 100% of the claimed amount is payable here. So the normal non-medicals which are not payable under the policy, and if there is any proportionate charge involved, so those all deductions will not happen. 100% of the claimed amount will be paid. Okay, but again subject to the sum insured limit. Widow or widower cover, if an employee passes during the policy period, okay, during the period from 24th December till 23rd December, if an employee during the course of employment expires, so normally what happens is the whole family is removed from the medical insurance. Okay, but under this condition, what will happen is the family still remains covered till the end of the policy period, that is till 23rd December 2021, irrespective of the employee being on employment or alive. Okay. De facto spouse, as in living partner cover. So this is also extended this year. Life-threatening complications during maternity. Okay, if there is a maternity. So this also I will explain in the next slide when we are going to maternity. What all are covered under medical insurance? So any kind of room expenses, as we have mentioned in the earlier slides, up to the room rent limit, any kind of room expenses are payable under the policy. It can be in a hospital or a nursing home. Please note, it has to be in a hospital or a nursing home which is registered by the medical association. It cannot be in a clinic which is not registered with the medical associations. Okay. So the admission has to be in a registered clinic or a nursing home or a hospital. Nursing expenses are also paid along with surgeon, specialist, medical practitioner fee, that is the doctor's fee or the specialist fee is also payable. The cost of the complete treatment is payable under the policy. Medicines and diagnostic cost is payable under the policy. If there is a requirement of blood or oxygen, the cost is covered under the policy again. Cost of the pacemaker, artificial limbs, organ transplantation charges are payable. When I say organ transplantation charges, the recipient has to be insured under the policy. It is not the donor. Okay. When the recipient is insured under the policy, his complete hospitalization expenses, including the surgery, are covered under the policy. But what happens to the donor's surgery? Because donor also has to have his body, means an organ to be removed from his body. So there has to be a surgery for him, as well as once the organ is removed, there is a culture which is done so that it fits into the body of the recipient. So those expenses are also covered under the organ transplantation charges. Operation theater charges are payable under the policy. Surgical appliances are payable under the policy again. Dressing, ordinary splints and plaster casts are payable. Physiotherapy is also covered under the policy, but it has to be after a surgical event, then only it is covered, and it has to be advised by a doctor. Dialysis, chemotherapy, and radiotherapy are also covered under the policy. Daycare procedures. Initially, I have mentioned that there has to be a 24-hour hospitalization, then only the policy covers it. Yes. But at the same time, there are some procedures which can be done within, means less than 24 hours because of the medical advancement. So those kind of surgeries are defined under the policy. There are 140 such daycare procedures which are listed, and those surgeries are also covered under the policy. For example, dialysis doesn't take more than 1 or 2 hours. So the person goes to the hospital, he's there in the hospital for 1 or 2 hours, gets his dialysis and gets discharged on the same day. So which is less than 24 hours, it is still covered. Chemotherapy is covered, radiotherapy is covered, cataract or eye surgery, which doesn't require more than 2 hours, is covered. Dental surgery, if it is because of an accident and there is a disturbance in the jawline or teeth, so then it is covered. If it is bad tooth or a root canal to be done because of the bad tooth, those things are not covered under the policy. It has to be purely because of an accident. Lithotripsy, tonsillectomy, sinusitis. So all these, there are such 140 daycare procedures which are described under the policy, and those are covered by the insurance policy. Maternity cover, it is covered up to 50,000 for normal delivery and 50,000 rupees for C-section. Okay, for any cesarean case or a normal delivery, it is covered maximum up to 50,000 rupees. And it is covered for only first 2 living children. So when I am saying first 2 living children, so the covers what we have missed in the previous slides, one was about the abortion. So as soon as we meet a doctor, and if it is the first conception, the doctor says it as G1, gravida 1. Similar ways, second conception, it is said as G2. Third is said as G3, irrespective of it being a delivery or abortion. Okay. So normally policies cover only 2 deliveries or abortions. Okay. So it can be, let's suppose the first one is an abortion and the second one is a delivery and the third one is again delivery, then only first and second, that is the abortion and delivery, are covered. Okay. And let's suppose the first one is a delivery and the second one is an abortion and third one is a delivery. So only the first 2 events are covered. So that used to be the trend earlier. But under your current policy, it is covered up to first 2 living children. Okay. So first being a abortion, so that's also covered. Second is again a delivery where 1 child is born. And third is again a delivery, 1 child is born. So then it is covered up to the first 2 living children, means all G1, G2, G3 are covered. Okay. If the first delivery has twins, then only the first maternity is covered because there are already 2 children. Okay. If the first delivery is a single child and second delivery is twins, then yes, again, first delivery is covered as well as second delivery is covered completely. Okay. But the children who are covered under the policy will be only 2. So you will have to make a choice which of these children you want to cover. This maternity or cover also has a 30-day prenatal and 60-day postnatal expenses, which are again covered within the 50,000 limit. Infertility treatment is not covered under the policy. So any treatment related to infertility is not covered. There is no waiting period under the policy for maternity. So anybody who is due for delivery tomorrow is also covered under the policy. So it has to be only the self and spouse who are covered under the maternity cover. Okay. Children and parents are not covered for maternity. As soon as the baby is born, babies might have some kind of health disorders. Okay, something like jaundice, for which he has to be kept in an ICU or something, or an incubator for premature births. So those kind of expenses are also payable under the policy. And as soon as the baby is born, the baby is covered up to the full family floater sum insured. Let's suppose somebody has a 5 lakh sum insured and maternity expenses 50,000, whereas the kids expenses, the baby's treatment related expenses are another 2 lakhs, then those are covered up to the full sum insured limits. Okay. But please note this 50,000 maternity is also within the family floater sum insured limits. And whenever there's a maternity, please take 2 separate bills for mother and the baby. Okay. The reason being, if you are taking a single bill for the mother and baby and the baby has a complication, then his bill also gets triggered only under maternity claim. If you are taking 2 separate bills, then mother's delivery expenses will be covered up to 50,000 rupees and baby's expenses are covered up to the family floater sum insured. So always take 2 separate bills, one for the mother and one for the baby, so that you get a apt reimbursement. And one more condition we have missed here is life-threatening complication during maternity to be covered up to full sum insured. During the delivery, if the mother has some kind of complication, and if it is life-threatening in nature, in such situations, the mother is also covered up to full sum insured limits and not limited to the maternity limit of 50,000. Okay, only if it is a life-threatening situation for the mother. Midterm inclusion is not allowed for existing dependents. Please note, I have missed adding my spouse, I have missed adding my child who is already 2 years, I have missed adding my parents. So these kind of addition requests are not entertained under the policy. If there is a new addition of a spouse because he has got married recently, then he can add his spouse under the policy, he or she can add under the policy. So, but this has to be intimated to the HR within 15 days of the event occurring, means within 15 days of the marriage. Similar way, a baby is born in the family, then the baby has to be added under the policy within 15 days timeline. Otherwise, they cannot be added till the next year if you are not intimating HR within those 15 days. Okay. So dependence of existing employees, and if they are existing dependents, then they are not covered under the policy until next renewal if you are intimating it in between the policy period. And you cannot do any additions or deletions unless deletions can be done only if there is a death in the family. Additions can be done only if it is a newly married spouse or newly born baby. Otherwise, you cannot do any kind of additions or deletions. Now coming to the exclusions, that what is not covered. So any injury or disease because of a war or warlike situation are not covered. Any injury, disease because of nuclear weapons or those materials which contribute to it are not covered. Sterility, venereal diseases or circumcision is not covered under the policy. Any kind of cosmetic or aesthetic treatment is not covered under the policy. Any kind of plastic surgery again is not covered under the policy unless and until if it is because of an accident or any kind of illness which leads to a plastic surgery again. Surgery for correction of eyesight, cost of spectacles, contact lenses, hearing aids, including cochlear implants are not covered under the policy. Even durable medical equipments are not covered under the policy. Dental treatment, as mentioned, is not covered under the policy unless and until it is because of an accident. So somebody had a trip and fall due to which there was a injury to his jaw and it has to be treated, then it is covered under the policy. Otherwise, not. Naturopathy, unproven procedures or treatment which are experimental in nature, and if there are alternative medicines which are offered, any kind of acupressure or magnetotherapy related treatments are not covered under the policy. Outpatient treatments are not covered under the policy. Outpatient diagnosis, medicals, surgical procedures are not covered under the policy. Any non-prescribed drugs, medical supplies, hormone replacement therapies, any sex change related treatments are not covered under the policy again. And any kind of service charges or admission fee or registration charges at the hospital, even if it is during hospitalization, are not covered under the policy. Doctors' home visit charges or attendant charges, nursing charges are not covered under the policy during pre and post hospitalization also, except in case of domiciliary hospitalization. Hospitalization for rituximab injection, which is related to cancer, is again not covered under the policy. Expenses or irrelevant investigations or treatments, any private nursing charges, or any referral fee that is paid to the family physician or an outstation doctor or a surgeon are not covered under the policy. So fee of the outstation doctor or surgeon or consultant is covered, but any referral fee is not covered. Genetic disorders, stem cell implantation, surgery or plastic surgery is not covered under the policy. External or durable medical equipments are not covered under the policy. Treatment including CPAD and CAPD are not covered. Ambulatory devices like walker, crutches, bells, collars, splints, glucometers, thermometers are not covered under the policy. Any kind of medical equipment which could be used at home subsequently are not covered under the policy. Non-medical expenses including personal comfort, convenient items, telephone, television, barber, beauty services, baby food, diet charges at the hospital are not covered under the policy. Treatment for obesity or weight control programs are not covered under the policy. Injury arising out of hazardous activities like scuba diving, motor racing, parachuting, hang gliding, bungee jumping are not covered under the policy. Treatment received in convalescent home or hospital or at hydro or nature care clinics are not covered under the policy. Outpatient treatments are not covered under the policy as mentioned earlier. And any hospitalization where no active line of treatment is there, that is not covered under the policy. Even if he is admitted for more than 24 hours and there is no active line of treatment happening, then those kind of treatments are not covered. Those kind of hospitalizations are not covered under the policy. And all treatments have to be within India and it will be paid only in Indian currency. Okay. Two more things that are not mentioned here is any treatment or expenses related to a hospitalization which has been after a suicidal attempt are not covered under the policy. Any drug or alcohol abuse to the body which leads to a hospitalization are not covered under the policy. Person does excessive smoking due to which his lungs are affected or any other part is affected and has to be treated is not covered. Somebody who drinks or smokes a lot, has a liver affected and has to be treated is not covered under the policy. Okay, and these exclusions are not limited. Okay, this is just an illustrative list and the major exclusions are highlighted here for you. Now let's discuss about cashless hospitalization and reimbursement hospitalization. Cashless is whenever there is a network hospital, a hospital which you are visiting is there in the network of the insurer and the TPA. So you can just show your card, health card, which has come to you, e-card or health card, what we call it as. You can show it at the hospital and avail a cashless treatment. If it is a non-network hospital, it leads to reimbursement. It can be either a non-network hospital or I am in a hurry and I don't want to wait for the cashless procedures and all. And I want to get a reimbursement, I want to go for reimbursement, then in such cases, you can go for reimbursement claims. Cashless can be of two types. The first one being planned and the second one being emergency. So what is a planned hospitalization? In case of non-emergency surgeries, okay, something like probably somebody had a heart attack today and an angiogram is done, but angioplasty, for the angioplasty or the pacemaker, the doctor gives a future date. Okay, if it is not urgent. For a cataract, there is a future date given. For a knee joint replacement, there is a future date given. For many surgeries, there is a future date which is given. In such cases, you can submit your health card at the TP insurance desk. Insurance desk will inform hospital insurance desk. Hospital insurance desk will inform the TPA and keep the necessary approvals ready by the time you come and visit the hospital for the surgery on a future date. So that's called planned hospitalization. But there are emergency events too. Somebody has met with an accident, somebody has a heart stroke and has to get admitted into the hospital. So these are all emergency situations. In such situations, you can visit the hospital along with the patient, submit the e-card at the insurance desk, and insurance desk will take an approval. So you need not wait for the treatment to start. Okay, the treatment will be started by the hospital, but subsequently the approval comes for the treatment. That's called a pre-authorization approval. And that's how the cashless is approved. And during discharge, the final bill and all other reports will go to the TPA for the final approval. And you just have to pay the non-medicals and the admission fee related expenses and come out of the hospital. So where you are not incurring much of your expenses, most of your expenses from your pocket. It is completely cashless. So reimbursement, it can be either for planned or emergency, and it is a non-network hospital. In such situations, you can go for a reimbursement claim. So you have to collect all documents from the hospital from the start of admission till the discharge. So you have to also submit a duly filled claim form. You have to submit your UHID, that is the health card, and you have to submit Aadhaar card of the patient. PAN and Aadhaar of the employee are required. Discharge summary is required from the hospital, or a certificate is required from the hospital. If there is a death, then death certificate is also required. Final bill has to be collected from the hospital, which should have all the complete details. Complete breakup has to be there in it. All cash paid receipts have to be collected. If you have paid it in cash or credit card or by check, you need to collect all the bills related to it. Pharmacy and medicine bills along with prescriptions have to be submitted. Investigation reports. So you can't say that I have got the receipt from the diagnostic center or the hospital, but the report is not available. You need to submit the reports also along with the consultation papers. Hospital registration number and doctor's registration number on their letterhead is required. Or there is a form part B which can be filled along with. Follow-up advice and post-discharge from the doctor is required if there is a post-hospitalization related expense. Your company ID card and the cancel check. Okay, so these are what are required for a reimbursement hospitalization. So this complete list will come to you, not to worry on the front. Whenever there is a cashless request which goes to the TPA, it is approved in less than 2 hours time. So 2 hours is the maximum turnaround time from a TPA for any kind of cashless request. Okay. And it is at the time of admission also, because that's a pre-auth approval which comes, and at the time of discharge also. So the cashless approval is given by the TPA within 2 hours of the submission of the documents from the hospital. So please make sure that the hospital sends the request to the TPA and probably keeps one of us in copy so that we follow up with the TPA and get the approval done. Many times hospitals give an assurance saying that yes, we have already sent it to the TPA, wherein they would not have sent the request to the TPA till the time the next, probably they take time for collecting all the documents internally, but they give an assurance that they would have sent these documents. So always ask them to keep us or yourself in CC so that you can forward those mails to us and we follow up with the TPA for an approval on priorities. A reimbursement claim is settled within less than 15 days from the date of final document submission. So if you miss out any of these documents out of the list and you submit it after some days, so the turnaround time starts from the date of the last document submitted. Okay. Maximum, it takes 15 days for making the payment to the employee or the dependent. And within 7 days also, many times the reimbursement claims get settled. So that's on the medical insurance. So your questions you can type in the Q&A and we'll answer it after the session. So now we'll move on to the personal accident insurance. So accident as any unforeseen instance, any sudden impact to the body, any uncertain event that is happening due to which there is an impact to the body. That's called an accident. And accident can lead to death or disablement or dismemberment, we can call it as, or loss of earning capacity. So the policy covers will be explained in the next slide. Here only the employee is covered. The dependents are not covered under personal accident insurance. And the employee is covered up to maximum of 2 times of their annual CTC or a minimum of 10 lakhs. Okay. This policy is only a reimbursement policy and it covers any kind of accident at any place. It can be at the office, it can be at home, it can be on the road, it can be while you are on a holiday, it can be while you are abroad, okay, while you are on an aircraft or while you are on the land or the sea. So it covers 24/7 and a worldwide coverage. The policy is from Bharti AXA General Insurance. So what does the policy cover? It covers any kind of death because of an accident. So it can be somebody drowning, or it can be somebody while crossing the road, somebody slips at home and hits himself on the head in the washroom, or somebody getting down the staircase, somebody while driving, somebody while flying. So any kind of death, okay, and that fish doesn't fall under the exclusion again, because something like an adventure sport is not covered. So otherwise, any kind of accidental death is covered under this policy. Then again, an accident might not lead to death always. Many times it leads to permanent disability. So somebody might lose a leg, somebody might lose a hand, somebody might lose eyesight, somebody might lose hearing, somebody might be paralyzed probably completely. Okay. So permanent total disability is a cover where, again, depending on the kind of disability, depending on the percentage of disability and the declaration from the doctor, the permanent total disability triggers. So here again, 100% of sum insured is settled in some cases, depending on the percentage of severity again. Permanent partial disability, where the person might not lose his complete hand or leg, but loses only flanges of his finger or toes, or partial eyesight or partial hearing. In such situations, permanent partial disability triggers, and it is again a certain percentage of the sum insured depending on the severity. TTD is again temporary total disablement, wherein accident might not lead to permanent disablement, but there can be a fracture to the leg, or to the person can be in coma for some days, or the person, so any kind of these things which lead you not to visit the office or continue your work for some days, it's a temporary phase again. In such situations, the policy coverage of TTD triggers, wherein the employee gets actual weekly salary. Okay, let's suppose somebody is earning 30,000, then he would be getting 7,500 rupees per week, or 1% of the sum insured. Somebody has a 30 lakh sum insured, 1% would be 30,000. So, or 20,000 again, which is a fixed amount. Okay, any of these three, whichever is lower, is paid in such situations. So if there is a fracture or a temporary disablement, your earning is not stopped, irrespective of you being on loss of pay. Okay, but if you are not fit to work and doctor certifies that, in such situations, this amount is paid to the employee on a weekly basis. So the payment doesn't happen on weekly; it gets settled only consolidated once. Okay, but on a weekly basis, these payments are triggered. And this is covered up to 104 weeks. Let's suppose somebody is temporarily disabled for a longer time, then also this triggers. Education benefit is payable up to 2 children, and that is up to 1 lakh rupees. Education benefit, as in if somebody meets with an accident and there is a death of that employee, then up to 1 lakh it is covered for their children, and this is only for higher education again. House or vehicle modification is covered up to 25,000. That is, person doesn't have a leg now, so he may not be able to ride the same two-wheeler. He has to modify his vehicle. He may not be able to ride the same four-wheeler. He has to make some changes internally. He cannot use the same staircase at home. A ramp has to be built. So those kind of expenses are covered up to 25,000 rupees. Family transportation expenses are covered. The employee meets with an accident in a different city from the home place where they are staying. In such situations, the family can travel to that place and stay with him, take care of him. So those expenses are covered up to 25,000 rupees. Animal attack and snake bite is also covered. So if there is a snake bite, or if there is a wild animal attack or a domestic animal attack which leads to death or disability, so then that's also covered under the policy. Repatriation of remains or carriage of dead body is covered up to 5,000 rupees under the policy. Any death or disability because of a terrorist activity is also treated as an accident and is covered under the policy. Medical expenses are covered up to 10,000 rupees under the policy. What are the exclusions? Any kind of self-injury, intentional self-injury, or suicide or attempted suicide is not covered. So somebody jumps off the building and is not dead or is dead, and or he breaks his bones. So those kind of accidents are not covered because those are not treated as an accident, and those are exclusions here. So any suicidal death or disability is not covered under the policy. Any death or disability because of influence of drugs or liquor is not covered. Drunk and drive, or any kind of deaths because of it, of the drug or liquor, is not covered under the policy. Committing breach of law with criminal intent is not covered under the policy. Okay, participating in riots or any kind of murders, okay, those things are not covered under the policy. Insect bite is not covered under the policy. So somebody had insect bite and there's a dengue which comes, okay, due to which he dies. So those kind of deaths are not covered under the policy. Death because of war, invasion, act of foreign enemy is not covered under the policy. Death during childbirth or pregnancy or any consequences thereof are not covered under the policy. Any death because of venereal diseases is not covered under personal accident policy. Now we move on to term life insurance. Term life insurance covers only the employee and covers up to the same sum insured of 2 times of annual CTC or minimum of 10 lakh rupees. And this, so the insurer is Aegon Life Insurance again, and we are the brokers there. So what does it cover is any kind of natural deaths, that is somebody dies because of an heart attack or any kind of disease, cancer or something. So those, in those situations, the 100% of sum insured is given to the dependent family member or a legal heir. Any kind of death because of an accident or a natural cause or a suicide is also covered under GTL. So your accident is covered under 2 policies. One is personal accident policy as well as term life insurance. So somebody meets with an accident and there is a death in the of that employee, then he's covered under 2 policies. And here 100% of the sum insured is payable. So there is no percentage which is defined here. This is again a 24-hour worldwide policy. So death can occur in any part of the world. Death can be because of an accident, as I mentioned. It can be because of a natural cause. It can be because of suicide. It can be because of any kind of heart attack or a disease. Okay. So that's covered under the policy. There's an escalation matrix which is given to you all. This is very important. So whenever there is a claim, please do not approach the TPA directly. You can contact the people here. So you can contact Kirtana first, then Yogesh, then me if there's an escalation. So why do we say that not to contact TPA? Because if there is a delay at their end and you contact us at a later stage, then the delay has already occurred. So if you contact us, we will influence the TPA for a faster approval. And we understand what claims are payable, what claims are not payable. Even if there is a rejection, we can understand why is there a rejection, whether it is a valid rejection or not. That's why please contact us in case of any of the claims. It can be a cashless as well as reimbursement. You may call us to understand before hospitalization too whether these claims are payable or not. Okay, let's suppose somebody may have a query whether the dental claims are payable or not. So we will again ask you whether it is related to normal bad tooth or whether it is because of an accident, whether dialysis is covered or not. So those kind of questions also can be asked with the team. Okay, if there are any queries before the hospitalization. But you need to also give a proper consultation note for us to understand what kind of surgery is being done, what kind of treatment is being done for us to comment back. Okay. Thank you very much. So now the session is all yours. If you have any questions, please type it in the Q&A so that we can answer one by one. So we have one question in the Q&A as of now. As mentioned, it's a group insurance. Do I need to submit name and details of family members to generate separate e-cards? So all the details are there with the HR. So HR has submitted the details back to us for generating the e-cards. So if you have any discrepancy, please reach out to HR for attending this. Next is accidental death is covered in both GTL and personal accident. The question is, yes, accidental death is covered both in GTL as well as personal accident policy. So if there is an accident to the employee, then the family gets the death benefit under both policies. Does it cover sports related injury? So if it is because of a professional sport or an adventurous sport, then it is not covered under the policy. Okay, if it is a normal sport, let's suppose I'm playing football with my friends just for fun, then it is covered. Can this policy cover cataract? Yes, cataract is covered under this policy. As per the Aadhaar name, should be there an e-card. So let's suppose somebody's name is Krishna Murthy Naidu. Okay, and the Aadhaar card says KM Naidu. So then that's fine. But if somebody's name is Krishnamurthy Naidu and the Aadhaar card mentioned as something else, which is not related to any of these, so probably Rama Murthy or something, okay, then there's a discrepancy. So it has to be as per the e-card only. Then only the claim is payable, otherwise not. As per doctor, hospitalization is not required for cataract procedure. Yes, cataract falls under daycare procedure, wherein there will be only a hospitalization of 1 hour or 2 hours, and then he is discharged. So this falls under daycare procedure and is covered under the policy. What if we are not satisfied with the claim amount received? Can we get the details of non-medical claims with respect to hospital bill? So the non-medical claims, we will not be able to give it now, but at the same time, if you are not satisfied with the claim amount received, whenever there is a claim situation and there is a claim ID which is generated, then the settlement letter is also shared with you. The settlement letter will have the complete breakup of what is paid and what is not paid. And if still you have a discrepancy, you can always reach out to us and we will understand whether it is completely means it is justifiably rejected or not. If not, then we will take it forward with the TPA again. And if it is yes, if it is properly deducted, then nothing can be done there. Full body checkup and diabetes covered. Full body checkup falls under OPD, that is outpatient department. So it is not covered. Diabetes, is it covered? So diabetes is covered for an inpatient treatment. Okay, there is a treatment related to diabetics which has to be done, means there's an active line of treatment which is happening. then diabetes is covered. Okay. Otherwise, full body checkup or any other kind of checkups which do not lead to hospitalization are not covered under the policy. Can I claim one member of my parent and one member of my in-laws? There's no cross combination allowed. You will have to either insure your parents or insure your parent-in-laws, but you cannot have a cross combination. Can we claim for road accident? Yes, road accident is claimable, but what kind of claim it is what is important. So let's suppose somebody had an accident and has a fracture, not able to go to the office regularly, due to which there is a loss of pay or something. Then that's claimable. Somebody has medical expenses, medical related expenses, then those are claimable up to a certain limit. But again, a capital benefit has to trigger there. If there is a dismemberment, then that also can be claimed. So accident means any impact to the body at any place, anywhere in the world. So it can be on the road, it can be at home, it can be at hospital, it can be at office, it can be while playing, it can be while on a holiday. Irrespective of that, if there is an impact to the body and there is a damage to the body, then that can be treated as an accident. So it can be on the road too, as you mentioned. Does it cover surgery for my family members? Okay. What kind of surgery is it? Okay. So all the family members means all the family members as defined in the policy, I would say, are covered under the policy. So whomsoever data is already there in the policy, they are covered for any kind of surgery which involves treatment and which is payable under medical insurance. How can I update my name on the e-card if I need to? Please contact HR for this. If there is a discrepancy in the name or date of birth in your e-cards, please reach out to HR and then they will communicate to us.
Madan, there are a couple of questions on chat that's shared. I'll read that out for you. One of the questions is, can you send that 140-day daycare procedures, list of 40 daycare procedures?
Yes, we'll share the 140 daycare procedures list with HR, and HR, while uploading the policy copy, Vachna, you guys can attach this document too along with it.
Sure. Another question before you take up the one that's come in now. As mentioned, what all tests are included for prenatal and postnatal tests?
So the employee can offline interact with Kirtana on this, and she will give the details related. Okay. Because it has to be within the 30 day of the delivery. So what all tests are involved at the fag end? So those tests are covered under the policy normally, but still the employee can directly interact with Kirtana offline.
Okay, I think we're done with chat. You can pick up the ones from the Q&A, please.
For addition of spouse, do we need to contact HR or you guys? For midterm addition of any newborn spouse or newborn child, you need to contact the HR and HR will HR will share the details to us. So we'll not take the details directly from employees. So you have to contact the HR for this. Only in case of claims, you can contact us directly. Baby was born in December. Shall I add now in insurance policy? You are late for addition of the child into the policy, but still please submit your details to the HR immediately. We'll try as an exception, but these exceptions are not entertained by the insurer. So we are not sure whether the baby will be taken into consideration this year. Okay, but please submit the details as soon as possible. Where to access the list of covered hospitals or care centers? Okay, that's a good question. Vachna, we will share the credentials of the app. The app is called Sparrow, which can be probably circulated to all the employees. And it's a user-friendly app where you can access the list of hospitals. You can access the details or the status of your claims, what you have submitted. You also have an option to check which pharmacies are providing discount. You also have an access to check which clinics or which diagnostic centers are providing discounts. Okay, so those are all available on the tab. So we'll share the credentials with HR and HR will share it to you, or a TPA will share it to you directly. And you can access all these on it. And even the app has a provision of some kind of videos and some kind of images, which will be on nutrition, which will be on yoga, which will be on meditation and all. So this is more on the wellness front, which happens. Okay. You can also access the list of covered hospitals or care centers on the FHPL website, okay, which also will be shared to you along with the deck. The reason we don't share the covered hospital list or care hospital list immediately, the reason being it's a dynamic list. So it keeps changing on a daily basis. So today a hospital which is not there in network might be in network tomorrow. And today a hospital which is there in network might not be in the network tomorrow. So there is a dynamic change which happens on this because of the various empanelment procedures which happens between a TPA insurer and the hospital. Okay, so you can access it on the website of FHPL. The link will be shared to you, or you can access on the app where the credentials will be shared to you. X-ray and CT scan are covered under insurance if these lead to hospitalization or if these are done during hospitalization. Independently, if I am getting an X-ray or a CT scan done, then it is not covered. Okay. So if it leads to hospitalization and if it leads to active line of treatment, then only it is covered. Otherwise, any kind of test, any kind of pharmacy bills, which are not because of a hospitalization or which do not lead to a hospitalization, fall under an OPD, that is outpatient department, and are not covered under the policy. If employee is on medication for epilepsy, will the amount be reimbursed for medicines? I'm not sure on this. So probably you can contact Kirtana in the escalation matrix, which is given to you, and she will reply back to you on this. Okay, I'm sorry for this. Please contact Kirtana offline and she will help you out. What are the documents need to submit for addition of member like spouse or newborn? For spouse, newlywed spouse, you can submit the marriage certificate. Okay, if it is a recent marriage. But if it is a marriage long back, then that's not covered under the policy till the next renewal. If it's a newborn, you can submit the birth certificate. If birth certificate is not available and the baby is born a day before, you can you can send a mail to your HR and HR will take care of it. Hope I'm clear on the answers what I'm giving. If you still have any confusion, please put the question again and I'll answer it again. Prenatal X-ray and scanning cost covered under insurance is the question. Okay. So again, I'm repeating. So if these are within the 30 days of the delivery, okay, prior to 30 days of the delivery, then those are covered under insurance. But at the same time, please contact Kirtana offline for specific scanning or specific X-rays. She will clarify whether these are covered or not. In free medical insurance, shall I add my parents as well? So if you have joined newly, then yes, you can add your parents, but you are already an employee of the organization, then you will not be able to add the parents as on date. And you can add them only on the next renewal.
Yeah, I would also like to add the parental coverage is optional. It is basis nomination, and the premium would be collected from the employee depending on the number of parents employee covers. So whoever's asking this question, please reach out to HR and we'll help you answer this.
Is it possible to include my parent details now for insurance? So please reach out to HR and HR will answer. HR will give you the information on it. But if you are already an employee of the organization and have not added uh, the parent till now, then you cannot add till the next renewal. So you will have to wait. But if you have joined in the last 15 days of from before today, then yes, you can add your parents. Otherwise, not. So for adding any dependent who is existing, so who is not a newborn child or a newborn kid, and if you are not a new employee, then you cannot add your dependents till the next renewal. Does it cover preventive health checkup? So preventive health checkup is again an OPD related checkup, so which is not covered under the policy. In case if you have any further queries and do not want to discuss that in an open forum, you can always reach out to the escalation matrix. You can reach out to Kirtana directly for any kind of clarifications, and she will answer them to you. Vaccination is covered in this. Okay. So is vaccination covered is the question. So vaccinations are not covered. Any kind of vaccinations, probably for the kids or that which is gonna come, something related to COVID, okay, are not covered under the policy. So vaccinations are not covered. Similar way, the expenses related to vitamins are not covered under the policy. Please share the escalation email ID on the chat box.
Yeah, I'll take that question, Madan. So the entire deck with all the information will be uploaded on EaseWork, which has the escalation metrics as well as their contact details. So you can get these details from the policy document. The exact deck will be available on EaseWork shortly.
Unable to log into FHPL website showing invalid username or password. So please connect with HR or Kirtana for this. Please share the escalation email ID. Yes, this again will be done along with your website.
Any more questions would be helpful to key in your questions right now. If we are, otherwise we would be good to wind the session. It's just coming after a lot of wait time. Or like Madan said, please feel free to write, these questions. Some questions may pop up even after the session. Feel free to write these questions to HR and we can circulate it to Kirtana or Madan as needed. Okay, looks like that's about it, Madan. Thank you so much, as always, for patiently, answering all the questions and very clearly taking us through the policy coverage. And thank you, Arpita and Rajesh, for setting up this webinar. Thank you to all the lovely participants for attending the session and also actively participating, in the Q&A segment. As I mentioned, the updated policy will be available on EaseWork by end of day. You can use this as a ready reckoner to go through the policies and brush up on all the coverages. Any further questions, the escalation metrics will be mentioned in the policy document as well. You can reach out to the specific individuals. I think that's about it. Anything else as a signing note, Madan?
Thank you, everyone. Thank you, so Arpita and the team who has managed to have this session seamlessly. Thank you, everyone. Thanks, Vachna.
Thank you so much. Everybody have a good day. Thank you for participating.